So we're gonna dive right into nutrition. So a little bit about eating disorders. You're gonna learn more about this in psychiatric nursing, but you just kind of need to know the basic overview. There are a lot more categories now than what I'm gonna go over, but these are the general categories. So anorexia nervosa is classified as significantly low body weight for gender, age, developmental level, and physical health. Fear of being fat, self-perception of being fat, consistent restriction of food intake, or repeated behavior that prevents weight gain. I do also see it sometimes referred to as a clinical diagnosis with a BMI of less than 18.5. So that may come up. So bulimia nervosa is a cycle of binge eating followed by purging, vomiting, using diuretics or laxatives, exercise, fasting, a feeling of like lack of control when this person binges, average of at least one cycle of binge eating and purging per week for at least 3 months. And then binge eating disorder is repeated episodes of binge eating, also a feeling of a loss of control when binge eating, followed by an emotional response such as guilt, shame, or depression. Does not use compensatory behaviors such as the purging, as we just discussed with bulimia. Binge eating episodes can range from one to more than 14 times per week. Clients are often overweight or obese. So therapeutic diets, this is going to come up time and again, and especially if you're working in the hospital. So clear liquids are liquids that leave little residue. So clear fruit, juices, gelatin broth. Full liquid are clear liquids plus liquid dairy products, all juices, pureed vegetables. Pureed is clear and full liquids plus pureed meats, fruits, and scrambled eggs. Mechanical soft are clear and full liquids plus diced or ground foods. Soft, low residue foods are low in fiber and easy to digest. High fiber are whole grains, raw, and dried fruits. Low sodium are no added salt or 1 to 2 grams of sodium per day. Low cholesterol, no more than 300 milligrams per day of dietary cholesterol. The diabetic meal plan is supposed to be, or diabetic diet, is supposed to be a balanced intake of protein, fats, and carbohydrates of about 1,800 calories. Dysphagia, are pureed food and thickened liquids. And just to note that it's important to know that if there's any question about a patient being able to eat food or swallow pills, speech therapy needs to do a consult with them and do a swallow screen. Otherwise, it can be very dangerous. They can choke, obviously, but this can also lead to pneumonia if it gets stuck in a patient's airway. So that's very important to know with these diets. And then regular are no restrictions. And then you just need to know a little bit about the healthy food pyramid, what that looks like, and just, encouraging patients to make healthy food choices. Okay, so heat and cold. Cold. This decreases inflammation, prevents swelling, reduces bleeding, reduces fever, diminishes muscle spasms, and decreases pain by decreasing the velocity of nerve conduction. Heat increases blood flow, increases tissue metabolism, relaxes muscles, and eases joint stiffness and pain. I think it's helpful to think about, what heat versus cold, the effect it has on your blood vessels. That kind of helps me remember what benefits heat versus cold might serve in a given situation. So with cold, it constricts your vessels, right? So it's gonna prevent the swelling and helping with muscle spasms. And And then heat, on the other hand, is going to increase blood flow. So one example that I think is really important in heat versus cold, which you may be asked questions about this on a fundamental exam. A patient with sickle cell disease that's in a pain crisis, they need to receive heat, because if they're given a cold pack, that will constrict the vessels, and a lot of the pain is coming from these sickled cells. So that's just the best example I can think of when heat versus cold.